you want to put on your sexy face?
This
You
is
good?
it. This is the best you're getting.
All right. So, Steph, you're a doctor of physical therapy?
Yes.
Okay. Well, first of all, thank you for coming in and working with Ryan. His
Thank you
deadlift
very
is
much,
something.
actually.
There's not many things uglier than his deadlift, so we appreciate you coming in to help both of us work on it because I don't want to look at it anymore. How did you get here? Like, what's your path? How did you become doctor of physical therapy?
Yeah, so I have always been interested in the human body and anatomy and all that stuff, and I didn't want to become a medical doctor. That just wasn't interesting to me, the internal medicine side, but anatomy and joints and biomechanics stuff was always pretty cool.
Okay.
So I was lucky where I had that idea when I was in high school. So when I applied to college, I applied directly to PT programs, went through the undergrad part of the PT program, didn't hate it, then stayed through grad school. And as much as the grad school portion of it was terrible, the stuff that I was doing and learning was really cool, and I was still interested in, because I do know some people who went through grad school and then unfortunately realized, like, oh, this isn't for me.
Yeah.
And I wasn't one of those people. I came out and started working for a corporate PT clinic, and then kind of became a little burnt out on the PT mill side of everything. Got a taste of private practice, loved it, because you get to do whatever when you
can
are
make
in
a
private
difference.
practice. Yeah, you get the time when you can work one-on-one with people and really put all of your brain and your effort into it. In clinics, when you're seeing 3 people on the hour or every other hour, you don't have that time to sit and really think and make a difference in somebody, because you're bouncing from person to person to person.
You're going to PT
I'm
now,
going to a
right? Do you feel
PT.
like that when you go there? Like you're
I
like on a
don't.
factory line?
No, I don't. I don't know how corporate my place is that I'm going to, though. I'm not going to say like where it's at or anything.
Right.
But like when I go there, it's like a small. They're like a bigger PT company, but like it's a small office.
Mm-hmm.
So like it's just that office. They don't like. No, I don't really feel that way. But I understand what you're saying. I felt that way at places before, but
Yeah.
this one I'm going to is all right.
I feel
That's
like
great.
ATI is probably like the most common one, right?
Maybe
they're
out here,
everywhere, yeah.
where I was, it was different companies owned by Select Medical. They're kind of own the whole country. They're like one of the biggest PT conglomerates in the nation. They have clinics and they own hospital groups all over the country. And I think they're like they might be the biggest one, followed by.
Why does this sound scary? It's like the picture just keeps getting darker. Like they're bigger and bigger and bigger.
Yeah, I just picture some fat guy in a suit, just like.
So how did you go from your interest in PT, right? So when you were younger, probably early 20s, how did you take that into getting your doctorate, right? And into like powerlifting and that kind of stuff?
So, getting my doctorate in PT was always the goal from senior year of high school.
Wow.
And then went through and finished. But I've been an athlete my entire life. And I ran track and field. I dove competitively.
No way.
Yeah, I wasn't very good.
What? Oh, okay.
I started when I was the kid who at the town pool would be throwing all kinds of tricks off the diving board.
Really?
And then my mom
That's
was like,
awesome.
okay, I guess we'll put you in diving. And this was when I was in high school.
Yeah.
And I went and I was very out of my depth. There was another girl who was also like a late joiner, and we used to joke that we were just the worst ones on the team, which we were. Like, but then when anybody else would say something, the two of us would be like, "You can't say that." But
That's so true. That's about everything.
I lasted in diving for about 2 years or so, but I love track and field, and that was what my passion was. And my diving coach at the time, he was like, you either have the option of you stay on this team or you leave for track. And I was like, okay, Mom, come get me. Like, I walked out of practice.
Right.
I was sopping wet and just walked over, grabbed my diving bag, and was like, peace, and never went back.
What did you do for track?
I was a sprinter hurdler. You wouldn't
shit.
expect by the fact that I am so small, but yeah, sprinter hurdler.
So one of my good buddies he was a sprinter through middle school and high school. He's shorter than I am. He's one of the best bodybuilders I know.
Yeah.
And I swear that there's something to do with like muscle recruitment when you're young and like going through puberty and all that stuff, and then like muscle development when you're older.
Probably.
Ian Blair is a sprinter.
Really?
Yep. College too. Like he made it pretty far, I think. But he's a bodybuilder.
There's so many powerlifters that I know who used to be like track athletes.
Yeah.
Oh, listen, you're right, and it's so funny because it's like, I mean, just all the muscles and like the stretch. Did you do a lot of stretching? Mm-hmm. When like for track and everything, I feel like all that like is just getting you ready for like just being athletic.
Yeah, and I did track and field from 8th grade in middle school all the way through my first year of grad school.
Yeah.
I attempted to be on my collegiate team because I had 1 year of eligibility left because my sophomore year I had a season-long injury, so I redshirted that year. And so I was like, oh, well, I'll use that last year when I'm in grad school. That was dumb. The stresses of grad school and the demands of being on a collegiate track team.
Did you make the team though?
Oh yeah.
Oh, okay.
I was on the team.
That's the battle.
Like in college, there's not so much cuts when you're like recruited and everything. I technically was recruited, but the woman who recruited me was fired. I shouldn't say she was fired. She had left the school before I think I had accepted. So my name never got given to the head coach. So track practice started and I wasn't there. I didn't join the team until like a week after. And then I just had to kind of show up and jump right into it.
Okay. So athletics all the way up until 23?
2013, yep. And then my first year grad school, I just... I didn't eat well. I drank a good amount of beer. And I ended up gaining a good amount of weight. And then during that summer of 2014, I was like, okay, I don't like how I feel. So I started working out more. And then I was working out with my old track coach. Then my third and final year of grad school. So now we're in like the winter of 2015. I missed competing. Like I had done a few years off. I was like, I need to compete in something. Like just going to the gym and training is not fun. Yeah. Like I need a purpose. So I started powerlifting training because bodybuilding just wasn't as interesting to me. But powerlifting, I was like, oh, I'm strong. I've always been strong. Like, let's go. So I started powerlifting in like late 2015, competed in my first meet in April 4th of 2016. And I haven't stopped since.
Well, it's a lot more relatable, right? So, like, when you're competing in track or field, you were either the fastest or you weren't. Mm-hmm. And in powerlifting, you're either strongest or you weren't.
Yeah.
Right? Like, it's relatively black and white. Bodybuilding's just this giant gray bubble. And that's, you know, I have a similar story. Like, I played baseball most of my life. Towards the end, I was in more of, like, a beer league, mostly, even though we were in our teens. The guys, like, took it less seriously after, because I think, like, as far as like traveling competitiveness and stuff, it really dipped off at like 15 on the private side, like not in high school, but on outside teams. And then, you know, when it becomes less competitive, like you have a void and you don't even know it's there.
Yeah.
And then like you find lifting and you start being competitive in the gym with somebody and then you're like, oh shit, like there's that fire again. And then you just kind of take off and run with it.
Yeah.
So, okay. So when did you finish up your doctorate program?
2016. So I graduated May of 2016 and started treating in October after I had passed boards and gotten hired.
Okay.
And then you started competing. That's cool.
Yeah.
So what are your numbers, like your best numbers, I guess you should say?
In comp, because we're just going to go comp numbers, I just squatted 315 at nationals.
Okay.
I've hit 191 in comp, but I've also hit 205 in the gym for bench.
Okay.
And then deadlift is my event. And currently my meet PR is 430. I've attempted 451 and it's going to be there. But that was my fourth attempt at nationals. So I didn't end up getting it, but it wasn't because the strength wasn't there. It's just my positioning was gone because I was gassed. It was a long day.
What weight class are you in?
60 kilo, so 132 pounds.
Yeah, that's what I would have guessed.
Thank you for the pounds. I can't do kilos.
That's okay.
We when I was at Penn State, I actually voted on the weight class changes, and so we condensed from like I don't know maybe 11 weight classes to 10, but then they all changed, right? So it used to, like the traditional ones were like 181, 198, 220, 242, and then it changed to like 184, 205, and like I can't even remember the rest of them. So does USPA adopt that, or are they still traditional?
Yeah, USPA is still traditional.
Yeah, that's good.
USAPL like is the one who kind of transitioned over, but now that they've left IPF, they've gone back to traditional, and
Ah.
Powerlifting America is the one
Yeah.
who maintains the newer weight classes. And they switched them around again. I think they either split some classes or combined some. I'm not sure. It's not
Yeah.
a federation that I'm in,
Yeah.
so I can't say that.
I don't know what happened with all of that, but I feel like there's no point in competing in the USAPL anymore. For me, the only point of competing in that federation was at the chance to go to like an IPF or world event, and like I got invited to bench worlds when I was in college, and like that was cool, but like that wouldn't happen if I was in the USAPL now. Like there's nowhere you go after nationals.
Yeah.
So I like the idea that it's tied to an international federation. So if it were me lifting, I don't see a point in going to the USAPL.
Yeah. And that's kind of the conundrum a lot of lifters are in if they're starting to pick a federation. So it's like, well, do I want to be in a federation that has an international branch? What level of drug testing do I want to be in? There's so many different things that you can go with.
It probably depends on how competitive you are. Right?
Yeah.
If you're really competitive, you're going to go to that level where you can go international. If you're not that competitive, you're going to pick what's convenient.
Yeah.
Right? Like that's what it comes down to.
USPA has their branch of international as well.
Right.
I actually have been invited to be on their national team at Worlds in
Congratulations.
Gold Coast, Australia.
Oh,
Are you going to go?
Yeah.
Oh, cool.
Yeah,
When
I'm
is
going.
that?
Cool.
November 3rd through
Of
6th.
this year? Oh, that's exciting.
Yeah, so being a national, and it's just competing for the team award, so you're one of the top 6 women who's on the team, and they have top 6 men, top 6 women, and you're just competing for the team award event.
Right.
So I got a call earlier this week, and they asked, and after talking it over with like coach and family, we were like, yeah, we're doing this.
It's enough time,
Yeah.
right? So you can go into an off season where you're not too stressed out, and then go into a nice little meet prep.
Funny enough, no, there's not an off season. I'm also competing at a meet at the end of August.
Huh.
That has a 2K prize payout.
Oh, nice.
So I want to do that meet. I want to try and win that meet so I
Right.
can get 2K to pay for the trip to Australia. So after talking it over with my coach, he's like, I think we can do it. We're going to do a longer building phase leading up to that meet and a short peak. And then we're going to do something else leading into Worlds.
I mean, your coach knows what he's doing. I'm sure it's not the first time he's had,
Yeah.
2 meets in a 6-month span or so.
Yeah, and he's like, I think you can do it. It might not be your favorite thing the entire time, but as long as you're not doing this every year, you're not going to put yourself through too much of a ringer.
Right.
And that's also one of the nice things about being a PT is like when little stuff kind of goes wrong, I can help myself on my end to to feel better and work out an injury or something.
Do you see another PT by any chance?
No, I
Okay.
probably should for some things, because, when you're too close to something, it's so hard to get an actual view of what's going on.
Yeah.
But I did just meet someone recently, and her and I have very similar views on treatment and treatment styles. So if something goes, she's definitely the one who I'm going to go to.
Okay.
Because, I can walk in that office and feel like I can turn my brain off because I know you're going to treat similar to me, but different enough where you're going to get a different result than if I did it to myself.
Well, sometimes you need somebody to move things around, right?
Oh,
like
yeah.
You can't do that
I
yourself.
can't work
You're
on my
like
own
hooking up
back.
strings and pulleys.
Yeah.
Like there's no other way to do it.
Yeah.
I swear that's what I was going to ask you, because whenever I have the Graston tools and like the Theragun, and like I swear when I do it to myself it doesn't work, but when I have someone else do it, it feels great.
Does the Theragun actually work at all, though?
So it works
think so.
temporarily for decreasing muscle tension.
Okay.
Here's a pro tip. put the muscle on stretch before you use it. So if you're using it on your quad,
Okay.
like bend your knee back and have some tension on the muscle,
Right.
you'll get a better
That makes more
effect than
sense.
if like you were just kind of going into a muscle on rest.
Thank you so much, because I was telling you how I sit on my heels.
Yeah.
I always thought about, like, man, it'd be nice to hit it with the gun right now.
Gently. It will be
Okay.
pretty intense.
Yeah.
So just kind of start with a light hand and work into it as you go.
Oh, awesome. I will.
My wife has one of those guns, and I've used it a handful of times. I'm like, this thing sucks. It doesn't
like
do
it.
anything.
Yeah.
I mean, long term, I don't look for it to do anything. But sometimes, like, if I have like a knot in my back, or like I get done a workout and my legs, like right now, are like sore, I'll just run it on there. It takes the pain away a little bit.
I don't know. I always put like a value, like what it does versus the dollar that you spend to get it.
Yeah.
So
Well, it
it's-
was a gift, so
Well, hey,
Thank you.
then that's a great value.
it's not even mine really. It's my wife's, but I take it.
Prior to the podcast, we worked on Ryan's deadlift. You had him doing some stretching, a little bit of mobility work and stuff. Where do you stand on like dynamic stretching, static stretching, when and how to apply them?
So for mobility purposes, like if you're trying to increase your hip flexion to get in a deeper deadlift or to be able to sink deeper into a squat, you're going to want to do that mobility work before you squat. And a lot of people are like, you don't want to stretch that intensely before you do a big lift because it reduces your power. Yes,
They
if
do
you
say that.
only do it that one time. But if you're constantly doing that mobility work and you're doing it before every single squat, you're going to strengthen through that new range of motion.
When you say mobility, just can you clarify that? Like you're saying static stretching's okay?
Static and dynamic is
Okay.
mobility to me,
Okay.
because you can do more dynamic things where it's a more continuous movement, like a continuous articular rotations or cars, where you would be taking a joint through its entire range of motion, and that would be more dynamic than to laying on the ground with maybe your leg out to the side and really working on like an adductor stretch kind of thing. Either one I think is fine to do, and you just got to find the correct program for yourself and what works for you. But in the case of lifters and doing mobility and stretching before a lift, if you're trying to improve your overall mobility and sink deeper into something or get better positioning, you need to do that mobility work prior to training, because you're going to open that range of motion, but then yeah, in the beginning, it's going to stink a little bit because you might feel like, oh, I can't build the right tension. But as you work through that new range of motion, you'll strengthen and you'll maintain that new mobility, because
Okay.
you're not going to be able to just static stretch a muscle and then expect to maintain that new range of motion. You need to strengthen at that end range to be able to hold yourself there.
Okay.
So for you, doing the glute stretch that we did and then going in to do deadlifts is actually a great way to do that, because you stretched out the muscle, but now you're sitting all the way into that new range and requiring your strength to be able to start from that new position, as opposed to starting in that low position, then your hips raise up 4 inches and then the bar breaks the ground.
That makes sense.
This gives me a lot of relief because I've struggled with a lot of hip issues, like outside hip. And what'll happen is like, in the middle of a heavier squat, it almost feels like it's exploding. Right.
okay.
And I battled with it, at that meet that you hurt your shoulder at. I was dealing with the hip. You gave me that freeze spray. It kind of
Yes,
fixed things a little
biofreeze.
bit. And, but the only way I can really train legs with compound movements, especially a barbell, is by static stretching my adductors. But everything I read, everything I see is always like, don't do this, you're going to be weaker, you're going to be more prone to injury, et cetera, et cetera. But I'm pain-free when I do it. So, like, I feel like I've been going against the grain with that, but what you're saying is giving me a little bit of relief.
You read too much. Gotta do what I do. Just don't read.
You also have to, when you're reading those kind of studies, you have to think about what were the conditions of the study.
Right.
How long was it? Are these untrained or trained individuals? If you're looking at a 1 rep max after doing a lot of hip stretching, yeah, you're not going to be very strong because you've never squatted or deadlifted or benched with that new range of motion.
Right, so you're changing the elasticity of the muscle.
Yeah, but if you're doing it regularly as your warm-up, yeah, because if you're telling me that if somebody's trying to say, oh, you shouldn't do dynamic or static stretching before a workout, it's prone to injury, then like what is gymnastics and dance based on? Like,
Yeah, like what if you warm up and then you do the static stretching? Like say you walk on a treadmill for like 20 minutes.
yeah.
And then you do it. I mean, you're warm when you're stretching, right?
As long as
Isn't
you're
that the
not
same concept?
going to like crazy end ranges, even
Yeah.
cold static stretching, you're not gonna really injure yourself or hurt yourself at all. If you came in from outside and you're like actually physically cold and try and get into the deepest hamstring stretch of your life,
It just sounds awful.
that's gonna suck. But if you are warm, you walked on the treadmill, you warmed up your legs, and then you start easing into like a stretch, then yeah, it's fine.
Yeah.
Since we're on the topic of stretching, how long are you supposed to hold a stretch, and how long does it take, days, weeks, months to change your positioning?
So I like to hold things upwards about a minute.
Okay. That's not that long.
It's like a lifetime, dude. A whole minute of holding a position,
Dude,
I'll be screaming.
When I was doing Ramwad, it was like 4 minutes.
Yeah, like 3-4 minutes that
Yeah.
you're there breathing.
Yeah.
In one spot?
Yeah.
Yeah. And dude, my heart rate would go nuts. And then by the end of the 4 minutes, I would finally like have it calm down.
But then your foot's numb, and then you
Yeah.
just gotta like flop that.
So anyway,
around
back
for
to a
little bit.
minute. That sounds better.
Yeah.
Yeah, 1 minute.
But it also depends on what kind of stretching you're doing. If you're just doing like a static hold stretch, or you're doing a contract relax, which is kind of what we were doing, where I had
Yeah.
you press your foot into the plate to contract and get that stretch there.
That was
And
nice.
then relax, where you relax and then lean into it a little bit more to take up that slack that you just created.
Yeah.
There's so many varying numbers. I mean, you could probably pull multiple studies that show different things for different populations. I never give times to my clients when I'm giving like a home program or something like that. I truly tell them like, hold it until you feel like you're done. Because if you're just looking for seconds or repetitions of a mobility exercise, if it's a more dynamic range of motion mobility exercise, if you're thinking, oh, I need to do this for a certain time, or I need to do this for a certain amount of reps, you're not always mindful of the quality of that stretch or that mobility.
Okay.
I feel that because I used to set my
Exercise.
timer and yeah.
So I don't give like, oh, you should do this 15 times. Oh, you should do it 30 times. It's like, do it until you're done, and you'll know when you're done. And if that day you don't want to spend as much time on it, okay, I don't mind. But if there's a day when you do that one stretch, or you do that one mobility exercise for a few minutes, or 40 repetitions, I mean, it's not going to hurt you.
What I like about what you told Ryan to do is it was 100% applicable for his lifestyle.
Mm-hmm.
If you told him that he had to come in here and, walk around the block 6 times, stretch his calves for 20 minutes, do this for another 10 minutes, he wouldn't do it.
I could walk around the block 6 times, bro.
No, you couldn't.
Stop selling me short.
Come on, dude.
Do
You'd
that.
be in a coffin walking that far.
All right.
But it's applicable for him. Like, he can come in, he can do that, and he can just start lifting. I mean, in total, you're probably looking at maybe 5 minutes of his time.
Yeah.
So it's not altering his life or his lifting. It's not taking away from him, exercising or anything like that.
Yeah.
So
Most of the home programs, when I give them to my patients and clients, I try not to make it like, okay, so this is 7 exercises. It's going to take you 45 minutes to get through. You're supposed to do this many repetitions. I try and find stuff like, oh, you can do this during your Zoom meeting calls. Oh, you can do this while you're washing the dishes, or you're in the shower, or you're sitting on the couch. Oh, you're at the end of your day and you're just watching TV doing nothing. Sit on the floor. Sitting on the floor, personally, I'm more likely to start just randomly stretching something. So if I sit on the floor, even if I lay down, I'll be like, okay, well, maybe I'm just going to bring my knee to my chest while I'm down here. Oh, now it just turns into me stretching for on the floor a little while. So I try and give lifestyle changes as opposed to a rigid program.
Yeah.
Because people have lives, and they can't have, 5 days a week, I need to do my 45-minute workout on top of everything else I have going on in my life.
right.
It's not sustainable.
Where do you stand on like foam rolling?
If it makes you feel better, do it. I am not the biggest fan of just like rolling on a foam roller or kind of throwing yourself back and forth, but I know a lot of people who love it and it really makes them feel primed for their lifting. It's not hurting you. I don't care. You're not wasting my time. Do it.
It makes me tired.
What?
When I foam roll, I get like sleepy.
It's because you're probably laying on it.
No, I mean, I'm actively rolling.
That's the only thing I use foam rollers for is I lay on them.
Yeah.
Like I lay with it down my spine
Yeah.
and
Oh,
do different
that's
like
great.
thoracic mobility
Yes.
stuff.
No, she's not taking naps on it.
Right, I know what you're saying. Yeah, I'll do like the
Yeah.
like the
You see alternating, the
Yeah.
hugs, the bank robbers.
something like that.
Yeah.
No.
You gotta add
But I
in
know
those
what you
bank
mean.
robbers. They're
Yeah.
What about body tempering? Have you done any of that?
No, I don't have much experience with it, but I feel that it's just you become acclimated to pressure. It's not all the time breaking something up because the amount of force you have to use to actually cause changes in the muscle tension is a lot. I mean, most studies when it's done on massage show that it doesn't have much physical benefit to the muscle, but it has a wonderful benefit to the person where they feel significant release from it. But when you look at, the muscle during whatever study objective finding that they used to quantify it, it didn't really change much. So if it makes you feel better, do it. So body tempering, if you've tried it and you're like, oh my God, it's the best thing, it's the only thing that's ever worked for me and I'm never going back to doing anything again, go for it. But is it something that I want to do? Not necessarily. I guess if somebody really knew what they were doing and they're like, oh, we're going to go. Yeah, why not? What's the worst thing that's going to happen is it hurts a lot.
I don't know. Those things are like, some of them are super heavy and they're right near your spine.
Well, I would hope they don't put something that's like 100 pounds on me.
Yeah.
I'm small.
Yeah. It interests me. I've never done it.
Yeah.
Obviously, with Donnie Thompson being in powerlifting and being, at one point he was the greatest powerlifter of all time. So a lot of people picked up on what he was putting down, and he's doing it with NFL players. So there's probably something to it. I don't know enough to be able to decipher what's going on. But that's all. That's the furthest I've gotten with is that it interests me.
Yeah.
So.
I think it's cool. I haven't read any studies on it. I don't know if there's been any studies conducted on it.
It's so new.
In my assumption of kind of what I know about what happens within the body, I think it's just your body acclimating to the pressure. So that's why you can tolerate it more. But I could be very much wrong. And another guest that you have on here is like, so that's why she was wrong, and I'm going to give you every reason why.
Well, no, I mean you're stating that you're not familiar with
Yeah.
it, but we're actually I'm trying to get him here.
Nice.
Just because I want to ask him a lot of questions about it, and plus I look up to him. He was on the cover of the first powerlifting magazine I ever bought. So,
You bought a powerlifting magazine?
well, actually they were free at the
All
meets.
right. That's what I was gonna say.
But it was the
Selling
first.
the powerlifting
It was like what was that? Wasn't that Mark Bell's
He
magazine?
had
like
that power
Powerlift?
or something.
Yeah. No.
He used to put all the rankings there, and this is before I started.
I don't know. Donnie was on the cover of
actually know
it.
about
It was when he had just totaled 3,000 pounds. He was the first one to ever do it. It was a big deal. He did it at like 46 too, so he wasn't young when he did it. But I just remember looking up to him because I was just getting into powerlifting then.
Can I ask something to you?
Yeah.
Scraping or Graston, whichever one. Well, how do you feel about that?
I do it.
You do it?
Yeah.
Okay.
So
I love that. I love it.
Yeah, it feels so
personally.
good.
It's the one thing I've gotten where like I literally have felt and seen the results. But go on.
So I use scraping the most in more of like a chopping manner. So kind of how you'd use a Theragun. And
Oh, okay.
I have tools from Rock Tape, and they
Okay.
kind of look like if brass knuckles and an axe blade had little babies together.
That
Jesus.
sounds lovely.
Yeah,
That sounds awful.
almost. They took it away from me when I was going through TSA, and I had to mail it back to myself. Yeah, I flew out there fine, but on my way back,
Yeah.
TSA was giving me trouble, and so I was like, I'll just mail it. I'm not checking a bag, so
Yeah.
I'll just mail it home. It was the most expensive piece of mail I've ever sent. I think it cost me like $35 because it weighs like 3
You
pounds.
could like check the bag almost. What's check bag in like?
Yeah, but then you got to
50
check it on the
bucks?
way back too.
Oh, yeah.
I would have had to go through like everything again. So it was just like, just take it. It's fine.
Yeah.
Like I want to go home.
So you do Graston.
What are you actually doing during Graston? Because I see the people on Instagram with the steel blade and then they get all red. What's actually happening during that process?
So the course that I took was from Rock Tape, and they focus way more on the neuromuscular aspect of it, that you're not affecting the muscle itself, you're affecting the neurons and the nerves that are sending signals to the brain, and then the brain sends the signals back to the muscle to have that relaxing effect. So when you're doing more like quick brushing techniques like this, the idea is to stimulate the muscle and get better contractions. When you're doing those long, deep, slow,
Yeah.
you're trying to
Cracking the. fascia.
trying to cause relaxation and just like a down regulation. So the brushing is more an up regulation, the deep pressure is more of a down regulation, and then the chopping, how I use it is more the physical breaking up, but you're not physically breaking up anything. You're just allowing better sliding glide of all those muscles and layers, because you're really not going to break up fascia. I mean,
Oh, okay.
it's kind of hard to just physically do anything with your hands. I mean, next time you have a chicken breast, cut that little skin off of it that it has, that little white filmy, and then take it between your hands and try and rip it apart that way. That's fascia. You're not going to do much damage.
Huh.
When I had Graston done, it was back when I was still powerlifting. My erectors were super thick back then, and that's what she scraped on. I noticed like relief almost instantly. Like somehow, some way, it got through all that muscle, and I noticed like my mobility, even the way I like would stand, it just changed.
Yeah, so that's the down regulation. So you're affecting the different mechanoreceptors in the muscle, talks to the brain, and the brain's like, okay, we're going to down regulate, we're going to relax, we're going to decrease that tension. And that's exactly the effect that you're going for, that relaxing effect, like, oh, I can move.
So when would you apply something like that?
If somebody has like a lot of tightness and soreness and pain, and not so much like, oh, I just worked out and I have that muscle fatigue, you can use it then and it's not going to have a negative effect, but it's not going to have like a crazy greater effect. Again, you're just having that relaxation and down regulation. So anytime you have like a muscle that's just holding a lot of tension and it's just firmer than it really should be, it feels tight, it doesn't feel like it's moving.
My
so like your
quads.
quads.
Yeah, my quads too.
I'm gonna stop by.
Yeah.
Yeah, this sounds great. Yeah, as you're saying it, like I can feel like the throbbing and like my muscles. They're like freaking so sore. But go on, sorry.
Yeah, so that's the down regulation is really what's going to cause that relaxing. So you end up having decreased discomfort and increased motion and movement.
What's the redness from?
It's just the friction.
Okay.
And sometimes you're breaking blood vessels, like little tiny capillaries. There are some schools of thought where you want to encourage bruising, and because that brings the blood and the nutrients and everything. And then other schools of thought are like, if it happens, it happens. If it doesn't, like, we're not going to try and make this person bruise and bleed.
Makes more sense.
Yeah. So I subscribe to the thought. I'm sorry. I subscribe to the thought of, if the bruising happens, it happens, but I'm not going to sit there like going after your leg or your arm or back to like cause bruising so that we can bring nutrients and blood to the area. Like,
what are the top like body parts that you typically apply Graston to? That seem to be the most common.
Backs, upper traps, and like quads a lot of the time. I'll use them on calves. I'll use them on biceps.
Oh, the calf.
Forearms.
So sensitive.
Mm-hmm.
Hey, we're gonna talk about calves.
Listen, I had it the one time and it was the one you're talking about that causes the bruising, and the doctor, she lightly grazed like right the inside of the back of my knee, and I was gripping like the table like it was hurting so bad.
Yeah. I try not to do a lot of treatments. Like you should, to me, I want you to be able to relax. I don't want you to be sitting there like white knuckling a table.
Right.
Because when you're doing that, your body is like in a defensive state, like because it's under
for sure.
attack.
Yeah.
So
yeah.
it doesn't allow that relaxation.
Yeah. I was
so
like gritting my teeth the whole time.
And that's one of my tips when I give people stretches is you should be able to have a phone conversation, like a business meeting phone conversation.
Oh, I love that. Thank you.
Like you should feel a stretch, but you shouldn't be holding your breath. You shouldn't be like wincing and trying to force it as far as you can. You want to be able to breathe into it and use your breath to increase space and relax into it.
The only thing you're going to be able to do is lay down.
I know. That sounds great. So what do you offer? You offer as you call it scraping.
Mm-hmm.
Okay, you offer scraping,
Cupping.
cupping.
Do you think that works? Cupping?
It makes like it can increase range of motion and it helps people a lot of their just general symptoms. It kind of gives them the feeling that they can move a lot more.
And what's that doing? It's just promoting blood flow?
Yeah.
Okay.
Promoting blood flow, and you have the vacuum of the tissue being lifted up in the cup. So the thought process is you are getting separation of those layers of tissue.
Okay.
And when I use cupping, I put like a lotion or a lubricant on the skin and I glide the cups. So
Okay.
you're getting a change in pressures across the tissues.
So that's what I'm getting done on my elbow right now. The mobile cupping.
Yep.
Is it helping?
Oh, I know. Listen, that feels amazing. Like just the gliding into the thing, and it does it. It's like it was sore afterwards. I don't know if it's supposed. It was sore afterwards. Like I worked it. Like well, it wasn't pain.
Like
It was
you
it
train
was getting,
forearms
like it
or
was,
something?
yes, like it was getting worked on. Like I felt relief from it. I have really bad elbows, so like we're still working on it. But like the first time she did it, it was just like a good sore afterwards. But it did give me like instant relief though. Like you said, it feels like it was pulling, like what is it pulling?
The tissue.
Yeah,
It's
the
just
tissue
lifting
up,
and
yeah.
getting separation through all those
So
layers of tissue.
So you do the mobile cupping, you do the scraping.
I do dry needling, which
wow.
is like a form of acupuncture. So it's
Yeah.
under the umbrella of acupuncture. And this is more of you're looking at the trails of nerves. So coming out of the spine, and you're looking at, is this a neurological reason that you're having like these zones of dysfunction? So like trigger points and knots and stuff like that. Like if you have a lot of trigger points in your quads. While assessing that, and I could just take a needle and pop that through, and you get a twitch effect, add some tens to it so you get the contractions through the whole muscle. But if you're just doing that, you can be missing a lot of things. So you want to look at a full neurological exam of how the muscles are functioning so that you can find out, oh, is this just like it's a quad issue, or is this all from the nerves that stem from this nerve root, and you can track it all the way down the leg kind of thing.
I'm just thinking like neurological pain. Like, do you think that people have like shadow pain at sometimes? Or is that what that would be called?
No, so I wouldn't
Ghost
say
pain?
that it's a phantom
That's
pain.
what it is. Yeah, I was close.
It's think of it more that
Like a nerve.
yeah, it's following the trails of the
Yeah.
nerves. So you have all the branches of nerves coming off the spinal cord. They all branch out, but then rejoin and then branch out again, and you can end up having symptoms of different pain and those kind of trigger point areas. They all fall along like a little pattern, almost like a stream all the way down the leg.
Is that type of pain typically like more chronic?
It can be because it's yeah, I would just say yeah.
Like sciatic pain. It comes, it like runs
Yes,
down the leg, right?
But no, so that would be more in the medical field, we call that radicular pain, as what like sciatic pain.
Ridiculous. Like I'm ridiculous. Is that
No,
okay.
just that statement is.
Okay.
So a radicular pain is a nerve pain or some kind of pain that is felt away from the actual area of dysfunction. So in a disc herniation, you feel numbness in your toes. Well, your toes aren't the thing that has the problem. It's the disc pushing on the nerve, causing symptoms into the foot. So muscle can also put tension on nerves and can lead to similar effects, but not necessarily as great because it's not as much pressure that's being put on the nerve.
So that was with my elbow because it hurts right here. Mm-hmm. We were talking about that, how it may be like a nerve pain. Mm-hmm. And that's why we were running it around it. I don't know if that makes sense.
Yeah, just trying to clear up space. Like, you have multiple different like nerves that come down into your arm, like your radial nerve, musculocutaneous nerve, and ulnar nerve. And depending on which one they're working on, like a lot of stuff gets bundled around the elbow and then down into the forearm. And if you have, like you're saying, bad elbows where you have a lot of issues with them, then yeah, nerves are probably involved.
Just my lockout. Yeah. When I go to lockout, oh my God.
Could that be from his shoulders though too?
Yeah.
Yeah.
A lot of elbow pain, like especially when it's like I have elbow pain with squatting, it's a shoulder issue.
No, that's how it's always been for me as well. But usually that shoulder issue for me was actually like a lower trap issue. Mm-hmm. And I don't know if there's nerves down there, but what would happen to me is I would just be sitting there, I'd feel fine, and then all of a sudden, the first time it happened to me, I actually thought somebody was holding a lighter to my tricep. Mm-hmm. It's like somebody's burning me, and there's nobody there.
Yeah.
And it was just that sharp pain, and then it happened a few times, after that, and I realized what it was.
Yeah, it can happen from the position of your scapula is not being held where it should be, and you have a bunch of nerves that come off of your neck and then come kind of over the front of your body into your armpit. It's called your brachial plexus, and when you have poor shoulder positioning with certain motions, you can end up with like those nerve symptoms. I personally end up getting shocks on my elbow that go all the way down to my pinky when I'm deadlifting sometimes.
Is that from low bar squatting? Like putting the pressure on your elbows?
It's from my shoulder position. Like, so I have scoliosis. Okay. So because of the way my skeletal structure is, it puts my shoulder in a more like rotated forward position, and I have to do a lot regularly to maintain its position there. I can't just do like rehab for 6 months and be okay. Like, I need to do that all the time, or else because it's my physical skeleton that wants to move in that direction. So I have to kind of de-rotate myself, and that's where it comes from. So my scapular position changes, and just something moves in such a way where I get the sparkles.
I never even paid attention to that until I was probably like 26, and a customer had come in the store. He's a chiropractor, and he starts like basically making fun of the way I was standing and how my shoulders were rotated forward. And he's like, "You have to come see me, man. Like, this is getting bad." And it's just not something I ever paid attention to until he said that. And then I started looking around, and like I feel like almost everybody from 20 to like 25, when they're still in the elementary part of lifting, like almost everybody's shoulders come forward like that. Do you see it a lot in the gym?
Yeah, and I also see it in like upper levels of lifters as well, in bodybuilding and powerlifting. People who are just so chest dominant and they're more rounded forward, and then being in that position and not straightening out, their upper back becomes more rounded as well. So they just have a hard time straightening out. And I'm actually currently working with somebody who's dealing with the same kind of problem. When he would go for when we looked at his overhead mobility, his arm got to like here and like here.
That's me.
Yeah, same here. Well, my left arm will go all the way. My right arm won't go anywhere.
Yeah, so for him, it was getting his shoulders back and down, but then also getting his spine a little straighter. You can have 8 different people with the exact same symptoms, and they're the eight different treatments. It'll follow similar styles and similar exercises, but the focus of the exercise or treatment is going to be different.
All right, so we got to dry needling. Mm-hmm. Okay, what's next?
I also do custom mobility programs. So if you want to work on your overhead mobility or your ankle mobility, hip mobility, I can build you a program based on what your limitations are and have you improve that way. Some people, it's not even necessarily the exercise. Like, they're doing all of the stretches and exercises that I would give them, but their intention or their posture positioning with their body is off. So they're more just cranking on a joint and ligaments rather than stretching them or strengthening a muscle. So I give the custom mobility programs. So you come in, we do a little assessment, then I build the program for you and take you through the entire thing so that you know how to do it appropriately. And I always tell people, like, hey, if you're in the gym and you have a question, come up to me. Like, it's fine.
Mm-hmm.
Like I'll give you your form cues. And I have previous patients who show me their lifts all the time and like, oh, what do you think of this? Like, I've been working on this. What do you think? Kind of thing. And then
Do you do massage?
yeah, but it's more like just quick relaxing massage with like on top of with some stretching on
Okay.
top of it. And those
It's
are
not
all
with the candles and the dim lights.
no music. No it's 20 30 minutes of just getting after whatever I feel is going to help you best kind of thing.
Do you think like deep tissue massage and all the different types of massages, do you think they have their place?
Yeah.
Yeah.
So also at Power Build KOP, we have PJ and he muscle mechanic.
Yeah, that's the guy I actually reached out to. He used to be in like Reading, right?
Yeah, so he also used to be I think he had like an office in Warhouse, but he's
That's-
worked in a whole bunch of places.
So we were talking to him at one point.
And he's deep tissue specialist, and I refer people to him, and I go to him myself. He's a phenomenal therapist. He really knows what he's doing when it comes to like, especially if you're a bodybuilder and you're carrying a lot of resting fatigue and soreness, and you have like you're looking a little bunched up and you don't have that symmetry that you're looking for. He just knows how to get in there and create that separation and pull it out for you.
He's a pretty big guy himself too,
Yeah.
right? So he's like just like you. He's like about the life, right?
Yeah,
So he gets
About
it.
the life.
He gets
exactly.
She's about that life.
Of course.
The muscle life. That is interesting though. When you graduated is when you started powerlifting.
Mm-hmm.
And then through that, do you think that like influenced, obviously it like influenced where your career went?
1,000%.
Right.
If I wasn't as into powerlifting as I am in strength training, I think I probably would not have left for private practice because, I mean, the general orthopedic population is a really fun population to treat. Like the post-surgical stuff. I even love the Medicare patients I used to have. They're just a lot of fun. But working with athletes was just, it all clicked. Like I could understand exactly what was going on so much better. I mean, if a golfer came to me and was like, "Oh, hey, I'm having trouble with my swing," and be like, well, "We're gonna find someone else for you because I know nothing about golf." So, I like my wheelhouse is like strength sports, CrossFit, weightlifting. I know a fair bit about running because of my background in track and field. But if somebody was coming to me for a very specific like tweaks on a sport that I really wasn't knowledgeable on, I would probably refer them out and be like we can do some work if you'd really want to. If that's going to make you happy, awesome. I'd love to work with you. I want to make you feel better. But if I know somebody who's going to help you even better than me, I'm going to give you that person. Because to me, it's not about just, oh, I want to get you as a patient. I want to keep you as a patient. I'd rather have that person feel confident that it's like, oh, I like her, and she wants to send me somewhere else because she knows that person's going to give me better care than she can. And so then maybe, who knows, maybe that person will tell their friend who's a weightlifter, powerlifter, general fitness person of like, oh, hey, like she doesn't do golf, but you should totally go see her.
Before I keep putting you on the hot seat with my million questions for you, what else do you offer? Let's just keep going through the list.
Aside from, I also have rapid reboot treatments. So the compression garments, like
nice.
the Normatec stuff.
Yeah.
So I just have it's the exact same kind of model. It's just a different brand name on the side of it. It's called Rapid Reboot, and it uses air compression for a massage and relaxation. So I have 4 different garments. One of them is like giant boots that you put on. They go all the way from your foot up your thigh, and it gives a circumferential massage all the way up the leg. And it's perfect for those times when you need like a giant foam steamroller to roll over your body. And I recommend though using that when.
So when you're just feeling like beat down?
Yeah,
Is that what
like
you're saying?
super sore, fatigued, like you just, yeah, super sore and fatigued.
Yeah, I used those before. I loved it. And then I used the shoulder one too. You have that one?
Yeah, I have both shoulders and I have hips as well. So it gets like
nice.
hips and low back. And more guys like the hips ones than women. I personally love the boots. I'll put that on for 45 minutes and almost fall asleep. It's so relaxing just sitting in your chair.
Because it's hitting your feet? Yeah.
And just everything else in general, it's just so comfortable and relaxing. Because it starts inflating at like the foot and the ankle, and then it does the calf, then it does around the knee, then it does the upper thigh. So it's very relaxing, it's very comfortable, and it just feels like a nice big squeeze to your legs.
Yep.
What else? I feel like it just keeps going.
Aside from PT, that's now we've kind of exhausted the list.
Okay, I'm going right back to my questions then. I'm just going to keep going. One of the things I learned from one of the John Meadows ebooks was stretching during lifting, right? So you'd hit a hard, excuse me, like let's say halfway through your workout, you were doing leg extensions, and you'd hit a really hard set, and then you'd stretch out the muscle. For me, that was like an efficiency thing, right? Is because I would just be standing there anyways. I might as well stretch. Then I don't have to take time out of my day later to do it.
Yeah.
Do you think there's any value to intra-workout stretching?
I mean, I've done it before and it makes me feel better in the moment. So, yeah, if it makes you feel better and you're not like taking away from your training because you're going to go lay on the floor and stretch for 45 minutes, yeah, just hitting a quick something to feel that lengthening and feel like the moving of the pump so you don't feel like you're just one giant ball of whatever.
Do you think it could contribute to muscle growth?
I don't know.
Okay.
I'm not sure.
It does make me feel better. Like when my quads are all pumped up and just stretching them out just gives you enough relief where like, I don't know, you just feel like you can get another set in.
Like I can keep going now.
Yeah.
Yeah, I mean, it would be similar to me, like, of walking it out after, like, a set of something. We're just taking, like, a little walk in between, just getting a muscle stretch, that moving in a different way than you were just doing it. So you get that feeling of relaxation and, oh, I can actually continue on doing this, as opposed to, like, falling into a ball of cramping on the floor.
When earlier we were talking about, excuse me, we were talking about the shoulders leaning forwards. And do you think that's a correction through like muscle building, or do you think that's a correction through mobility work?
It's going to be more strengthening because you need the physical strength of your muscles to pull yourself back into that position. I am not a fan of the bow tie things that you can wear to pull your shoulders back because it's just holding you there. You're doing nothing to hold yourself there. So if you're not building that internal tension, it's not gonna work and maintain any benefits.
I think why he made that and how it was used were actually two different things. Yeah, I think the message got lost there.
Yeah.
But I think he originally made that to position yourself better for relief during like a heavy squat, right? To give yourself a little bit of shoulder relief, not to like change your posture or anything like that.
And that's what people use it for. They don't use it for that intended of almost a reminder of being a little bit more open. And people use it in the sole purpose of like, oh, it's going to hold my shoulders back and I'll have better posture. No, you just need to learn how to hold yourself there.
So how would you, because again, my shoulders lean forwards, right? Still, even to this day. So what would you do to build up the strength so that way it didn't happen?
It depends on more what's the reason that you're in that position. Is it a mobility issue because you're super tight in the chest? Is it a strength thing where you are just super weak in your back and you just don't have that opposite pressure to pull you backwards? Because I mean, in life, we're more going to be in closing down in the front than, opening up and doing stuff and contracting our backs that way. It's not as normal of a position to be where we're all hunched over and we're forward like that. We're not so much backwards and upright. So it's going to depend on that individual person's reason as to what their solution is going to be. So if it's more strengthening, it's going to be positional holds and different band exercise, isometric exercises, plate loaded, something like strengthening to just improve that positioning and awareness of where your body is in space. There are so many studies that have been coming out recently showing that, I shouldn't say so many, but more studies are coming out showing that posture does not have a correlation to your pain. So you could be a very forward rounded person. It's going to be how often are you taking yourself out of that position? Are you able to bring yourself out of that position? Because if you're constantly like hanging forward, yeah, you're going to feel a lot of tightness in back because your body is physically trying to pull you back upright. That's where that tightness comes from. So people who constantly feel like, oh my God, my upper traps, like my shoulders are always so tight, that's probably a little bit of a weakness coming from low trap because you're now not getting that opposite pull. Because even though it's all one muscle, like your upper, middle, and lower traps are all one muscle, it's because of the different angles of pull that the fibers are oriented in, that if you're not getting good low trap activation, which is going to pull those scapula like kind of down and back towards midline, you're going to try and stabilize with the upper trap from above as opposed to below. So like when you see people doing lat pull downs and they're coming down and
same thing with pull-ups, right?
Yeah.
So they kind of
and
round
they
their
get the
shoulders over.
compensation that way to try and finish the motion, and they lose all that tightness in their low back, and they're more working the front. So that's more anterior work being done and not as much posterior work to keep you pulled open and in that more appropriate posture.
Do you think somebody who's maybe doesn't have shoulder roundness or shoulder pain or something related to that, do you think them training like a rear delt movement, like on the pec deck or the rear delt machine or dumbbells or something, is a good like preventative measure?
It can be, yeah.
Yeah.
Yeah. Like Supermans are a great one. We have some there's a common one of like W's where you're laying on your belly and you're lifting up and just contracting everything back and down to lift.
Can you do that?
No, I hate those.
There's another one that I give people called swimmers that they absolutely hate. You're laying on your stomach. And you take your hands and bring them up behind your head, straighten them out, and then bring them behind your back. But because you're laying on your stomach and you're pulling your shoulders back the entire time, you can't dump your shoulder forward like that to get behind your back. So most people who do them, they get their hands to like the sides of their butt, or maybe the top of their butt, and that's where the range of motion taps out. But that's a great way to strengthen posterior shoulder and keep that open up in the front.
Yeah, I never even heard of that, so I might try it.
Do you ever like come across issues of like inflammation, maybe from diet or just maybe bad sleep or, you know, substance abuse or whatever it may be, and like that is the root cause of pain? It
can be. I do talk a little bit about lifestyle stuff. I try and talk about getting adequate amounts of sleep and nutrition, because if you're not sleeping and you're not eating, your body's not going to prioritize that rest and recover. It's going to kind of just try and keep chugging along and just get you going and keep you moving, as opposed to getting that actual like, okay, we're going to start healing you internally.
That actually brings up another thing. When I first started lifting, I was doing tricep press downs at Planet Fitness, of course, and that was the first time that my neck ever like popped out. And what would happen is I wouldn't be able to move it to the right at all. I could only move it to the left, and it gave me a lot of pain. I go to chiropractors. Only one chiropractor could ever fix it. But the best way for me to reset I would actually just sleep like a robot and on my back. And that's the only thing I could ever do to get it to reset. Yeah.
Yeah, I mean, it's...
Well, what's sleep like a robot mean?
Flat on your back, no pillow?
No pillow, flat on my back, and I wouldn't move. I wouldn't roll over. Like
robots sleep standing up.
Well, this one slept.
Everyone knows that. Is that like a term?
I don't know.
No, you should. All right.
I don't know, man. My hands were down by my sides. I was on my back. I was stiff. I didn't move.
I'm just asking the questions that people want to know.
But that's the only thing I could do to reset it. And I still, to this day, struggle with that problem.
Yeah.
Actually, like, just sitting here right now, I can feel my lower trap throbbing. And I've been trying to pay attention to it more. When I train back, I can activate this lat great. I can't activate this one at all. It's strictly lower trap, nothing else.
Okay.
So I'm definitely dealing with something back here. It feels like there's a softball bulging out of my back. What? I'm not allowed to have problems.
I don't know why I thought that was funny.
Only you can have
Hey,
problems.
yeah, it feels like a softball out of my back. I'm like, oh, that's nice. That sounds awful.
Jeez.
You okay there?
Yeah, I'm dying. I struggle with allergies.
Is that right?
I think I'm allergic to your bullshit.
You didn't even hold on to that one there. You keep that in the old book.
That's it. Do you have anything else?
Well, we covered a lot.
I want to talk about calves.
Yeah.
All right. I know you're not a bodybuilder, and I know it doesn't really get you going the way powerlifting does. Mm-hmm. But I have a theory, and I can't prove it because I have small calves.
Okay.
But my theory is when people train calves, they're not actually training the muscle of the calf. They're training whatever's right underneath it. Is that still considered a calf?
The soleus? So not like the gastroc, not the big muscle
Not the
that
big
pops
guy.
out.
Yeah. So we had a calf machine in here, and it was a standing calf. And because of where the pivot points and everything were, when I would use it, I would only train right under the calf, and it would drive me absolutely insane. Right? And then we got this.
That thing.
I hate that thing.
I love
it. It was the worst piece ever. But then we got this little seated calf from Hammer Strength, and no matter what, all I do is actually hit the top of the calf, like the big meaty part.
Yeah.
Go ahead.
So you're in like a seated calf raise, you're getting more soleus, which is that deeper muscle. You could just be hitting it at different angles and feeling it more or less in different places. The standing calf raise, you're hitting more of that gastroc, so the big bulbousy muscle. The soleus is what's going to make the gastroc pop out.
Okay. The only time my calves even looked remotely big, not big, better.
Okay.
Better. Was when I was doing a ton of incline cardio.
Yeah.
Because I think that there's something to do with ankle flexion, right? And the mobility of it, and then the activation of the muscle. But for me, it was like a month of incline just to build up my mobility on my ankle. And then all of a sudden, I started feeling it in the calf, and then the calf grew.
Yeah.
So do you think there's anything to my theory
Did
of...
you measure it? How'd you know it grew?
I saw it in pictures.
Okay. All right. Wasn't the lighting?
It wasn't the lighting or the angle, but the guy was
Were
a
they
professional
shaved
photographer.
like they are right now?
They weren't.
Okay.
They weren't. So they would have been even bigger. But I feel all right. So my theory is first, your ankle has to have enough mobility, and then two, you have to be doing the proper movements to activate that part of the calf.
Yeah.
Before you can say that your calves are genetic.
Yeah.
Okay.
So
I'm onto something.
This is my own personal theory right now.
Because I have a lot of theories on calves.
Oh yeah.
Well, we just sit here and think about them.
So I've recently been getting into and looking more into foot strength and foot stability and foot health and stuff like that.
Okay.
And my brain theory is that when you have better grip and strength through your feet and better dexterity of your feet, and you can
have to look that
you
one
have
up.
strong feet, you're going to have bigger calves because all of the small muscles that control your toes and the midfoot and everything, they have a lot more muscle bulk to them. So it's going to fill out that entire circumference of the calf as opposed to the two main muscles, which are the gastroc and the soleus. So getting more of like the like just other muscles on the side of the calf and deeper to the sole, like deeper to the gastroc, that can help push everything out, and you're creating more volume internally so that everything looks bigger on the outside.
All right, so I have two questions. One, why do heavier people have really good calves?
Because
That's not true.
A lot of them do, though. Like a lot of bodybuilders, like Evan Centopani talks about it all the time. Is he was a bigger kid, and then he ended up with really good calves, and he diets down, and the calf muscle and the structure's still there. And I don't think it's uncommon. I mean, I see a good amount of people that are your size, and they're not bodybuilders, and their calves are amazing.
Okay.
So it's going to be having to do with how active the foot is while they're walking.
But Do you think it has anything to do with like the load?
It could be.
I can just picture him just staring at all these big people walking around, like, let me see them things.
Taking pictures?
The
Yep,
amount
like
of-
he's writing notes, like, my theory.
The amount of time I watch
Yeah.
people walk, though, and
Yeah,
analyze
Think about
their
that. Like,
gait.
No,
this
no, no.
guy watches
All the time.
calves all the time.
So you do it too?
Yeah, I watch
See?
people's gait. Like, I'll be sitting in the airport and watching people walk past, and I'm like, okay, so that person is doing this
Really?
and that and this and that.
One of my friends at Penn State, he put this in my head and it never could leave. So he said, you have to, before you marry a girl, you had to watch where her calf attached.
Oh, my God.
He said if she had high insertions, she was more likely to stay thin. And if she had a very low insertion,
Okay.
then she was more likely to be heavy when we were older.
Okay.
This is horrible.
That was his theory.
That's horrible.
So then it just started making me start looking at people's calves.
Okay. So
I don't know if it's true.
Where's your wife's calves attached?
She's like
there?
right in the middle.
That's
Oh.
the problem. Oh, my God.
That
Hey,
can't-
I had to check off the box.
I look at all calves.
He doesn't discriminate.
Yeah,
based on
no, I
calves.
appreciate all calves.
Listen, beggars can't be choosers.
I appreciate all calves. My wife has wonderful calves.
I like your wife.
What, you looking at her calves?
I'm not.
Yeah.
I'm not married to her.
Just staring at my wife's calves.
You can-
Calves,
you
not
can look
calves,
at the calves,
by the
you
way.
can't touch the calves.
Yeah,
Too many people say calves. Calves.
calves.
Calves. With a V.
Whatever you say.
Yeah. Okay, so
All right.
anyway, enough of that.
Yeah, I can't remember what my other part of that theory was. Let's see if I wrote it down.
I think we're good on calves, dude.
No.
That's enough of the calves.
All right, we're gonna.
I saw you have you have minimalist shoes though,
Yep.
right? That's what I have been pricing them out and looking at them
like
all
the barefoot
time.
shoes.
The Vivo Barefoot
Yeah.
is what I have. Yeah.
So you got the Vivo ones. How long have you been wearing those?
Since I got them in December. This is the only shoe I wear basically
Right.
now. I squat, I deadlift, I bench in this shoe.
So you squat flat-footed?
Yeah.
Okay. All right. A lot of the time, especially with women lifters, they have lifters on.
Yeah.
Now I don't use lifters either. I use a flat shoe, but I haven't bought a pair of minimalist shoes yet because one, I don't have the money for like the really expensive ones. They're like $180.
You can find
Yeah, Gucci flip flops.
Yeah, I wore them for 5 years straight. I wore those every day.
you can find like more price appropriate options and not like the priciness of Vivo Barefoot on
Right.
like Amazon. I think Zero X.
So
Zero's
Zero's
spelled
a
with an
little
X.
cheaper, but not by much. I go on Amazon and they have like all the bootleg ones, right? The
Okay.
bootleg Vivos. So I'm like, I wanted to try them to see if I liked them. But have you ever owned a pair of those, the bootleg ones?
No.
Okay. I'm just curious because I'm going to end up getting one of those just to see if I like walking around all day with those shoes on because I too watch Chris Duffin and talk about the foot health and
Yeah.
everything. And like you saw my feet today, they're very flat.
Yeah.
And I think that is the reason for a lot of like pain through my legs.
Do you have genetic flat feet?
Yes.
Yeah. Okay. So
Been flat my whole life.
with transitioning into a more barefoot shoe
Right.
with the wider toe box and everything, grade yourself into it. If your feet start to bother you, take them off and switch to a different shoe for the rest of the day, because kind of like forcing yourself to be on your feet like that it's just gonna be uncomfortable and
That's
sore
interesting.
and cause increased pain. There's no reason you should be pushing through pain like that.
Pain in the arch.
Yeah, like
Yeah.
or just foot pain. Like
I
if
would've
the
tried to
ball of your
push through
foot
it.
is bad, if the heel of your foot's feeling bad.
I just switched to my work boot is a higher heeled boot. It's called a logger's boot, logging boot. And just switching to that, I've never wore those before, but doing what I do now, all the guys that I work with wear them because they say it's more comfortable. And it is, but like switching to that, like a higher heel, was giving me a lot of foot pain.
Yeah.
And I was like, I'm just going to fight through it.
On the ball of your foot, right?
Yeah.
Yeah, it's
My
because all
whole-
your weight's
yeah.
been shifted forward.
Or-
So now you understand when women have been wearing heels for 6 hours, how their feet hurt.
Yeah. I do.
And that's only
It's
an
a 2-inch heel. It's a 2-inch heel.
Imagine
yeah.
you're wearing 4.
No, I don't want to. I don't think I look very nice in some heels.
I think it would make your calves look great.
It would build the calves though, wouldn't it? No.
No, because depending on how much you are resting on the heel,
Right.
you're gonna end up having shortening of your Achilles tendon as well, because since you're in that more pointed toe position, it gives the calf time to stretch out, like to contract together. And I mean, I know if I wear heels for a long time, even if it's like a wedge boot, like where it's a thicker heel and you're not balancing on something the size of an eraser, you put your feet flat on the floor and it's like, oh my God, like all my bones just moved, and not in a fun way.
That's why all the girls bring sandals to the weddings. So they can
That's
dance
why
in
everybody
sandals.
brings flip-flops or just goes
Flip-flops,
barefoot
yeah.
and gets stepped on.
All right.
But if you read our calf ebook, you would have known that you need flexion, which means
I
fixed
think
position, and the heel's not going to build it.
You exposed a little too much about calves on this. We might have to go back on this podcast.
Just call this one the calf.
Yeah.
Oh, I'm sorry, the calf episode.
Yeah, it's the calf episode.
So
You say calf, it's not calves. Go on.
no, I mean we can go down the rabbit hole of like shoulders, traps, and I want to do that, but I feel like we'll do that maybe another time. If the people watching this want to follow you, where would they find you?
At Foundational Movement Foundational Movement PT on Instagram. I put out content when I do.
And if they wanted to follow like your powerlifting and stuff?
00 Hanson, 00 Hanson, Hanson.
And just for clarification, your office is where?
Inside the Power Build King of Prussia location.
Cool. Well, Steph, thank you for joining us.
Thank
We
you very
appreciate
much
you
for
having
having
here.
me.
Yeah, thank you for helping
Yeah.
me. That's good.
That's it.
I'm gonna follow you on like everything now. I would like to come in actually.
No, I know. I was thinking the
Schedule
same thing.
something.
I'm like,
yeah, for the scraping and everything.
Yeah.
Do I set? Oh, we should have said that. I set that up through your Instagram?
Yeah, so you can book either online or you can
Oh, okay.
DM me.
Okay.
Is either fine. I have people who do both.
You have like a website?
Yeah.
Awesome. All right. Cool.